I added a Google form at the end too, in case so people can go to that link in case they want to sign up. Send us their email. We can send this around after if they're interested. So, yeah.
Okay, it looks like we are live streaming now. So,
okay. All right, we'll give it, I think, one more minute before, so we can let everyone trickle in.
Yeah.
Okay.
Okay, and there's just a delay in the videos that I'm seeing between our screen and Zoom. So yeah, we'll just wait a couple more minutes and.
Okay, great. Yeah, I think they recommend five minutes after the hour.
Okay.
So I'm seeing a few people already. Great. Okay.
All right.
All right. Ashley, Lewis, can you guys still hear me?
Mm-hmm.
Perfect. I guess we can go ahead and get things started then. Ashley, if you want to just do an introduction.
Sure. So good evening to those who are joining us. My name is Ashley Grieve, and I work as a warehousing and distribution analyst on the USAID Global Health Supply Chain Procurement and Supply Management Project. So that's a USAID funded supply chain project I'm just going to refer to as PSM, and Ryan or other presenters may refer to it as well. If so, PSM, we're talking about the same thing. So the USAID PSM project is the larger project under which this drone activity that we'll be speaking about was funded. It is implemented globally in around 65 countries, where we procure medicines internationally and deliver to those countries. And we also have offices in about 35 of them, where we're on the ground delivering technical assistance and helping to strengthen those supply chains. So specifically under these in-country efforts of technical assistance and last mile delivery of medicines is where our drone work fits. So that is what you'll be hearing about today. And our presenters today, our speakers today include Ryan Trish, who also works on PSM as a warehousing and distribution analyst, and also Lewis Hill, who is from one of the drone service providers that we worked with and is a pilot and will be able to speak to and answer some of the operational and technical questions. So with that, I'm going to go ahead and hand it over to Ryan. I will be monitoring the chat window. And if there are questions, I might just give them to the end, but please do enter your questions as they come up. Thank you.
Great. Thank you, Ashley. And I also want to mention we have one more participant from one of our workers that was in Malawi with us. And unfortunately, his technology is not currently working, but we do have a video recorded from him. So we will be playing that as well. So we'll show you that later, just from an on-the-ground experience from a Malawi perspective, which we think is really important. So with that, I'll go ahead and get things started really quickly. So Ashley gave us the introduction. So again, my name is Ryan Trish, and I work on the Global Health Supply Chain Procurement and Supply Management Project, which is a USAID project tasked with delivering health commodities for HIV, malaria, tuberculosis, and family planning all across the globe. And before we get started, I just want to do a quick activity with you all. So Ashley will paste this link into the chat below. It's a tiny URL link. And what I just want you all to take time and do is just come up with 2 to 3 things that come to mind when you hear the word drone. So, whether it's watching the news or reading an article, when you hear the word drone, what comes to mind to you? We're going to see if this works. I'm going to put on the screen here a, a little Wordle we're going to create, a word cloud. And if you could just go to that link and type in your answers. And while you're doing that, I'll kind of talk a little bit about our project while you're doing that. So back in 2018, we were working with USAID and some other partners to identify potential countries where we can utilize drone activities for health. And what we were looking at is, every country has different challenges with getting medicines or medical commodities, goods from the central area, whether it's a central warehouse, whether it's a government storehouse, all the way down to what we call the last mile. So last mile to us means the final health facility or clinic that patients will go to get the actual service they need. Sometimes it's a really small rural area. Sometimes it's a community health worker that actually goes and delivers pharmaceutical goods to the patient if they're sick. And what we were noticing is a lot of times in very low resource settings that there were numerous difficulties in getting health commodities from that central level to some of these last mile settings. And what we began to do is look at areas which we could pilot utilizing this new emerging technology, drones, it's been a big buzzword in the past few years. And we wanted to look at seeing A, if there was a possibility in any certain country where drones could be utilized, and B, how to best pilot an activity which we can do so to actually increase last mile access to medical commodities. So in 2018, we, along with some other partners, did a kind of a study of different countries, looking at the need for drones, looking at last mile access, looking at essentially what what groundwork was there. We looked at a few countries and ultimately we discovered that the country of Malawi in Southeastern Africa had a need for drone delivery. There, Lake Malawi. I'm not too sure how many of you are familiar with Malawi, but there's a really long lake inside Malawi. It's a very deep lake, and all along the coast there are small hamlets. I like to call them. They're very small fishing villages and communities, which are often cut off by road. And essentially, the only way to and from these communities is in a small boat. On top of that, there are two larger communities in the middle of Lake Malawi called Likoma Island and Chizumulu Island. They're actually situated along the coast, and these are only accessible by ferry or a very expensive chartered flight. And what we were noticing is all of these communities were having issues testing people for HIV, testing people for tuberculosis, and also getting medical access because there were no road systems to go there. Everything relied on a once or twice a week ferry, and everything relied on essentially small wooden boats, fishermen to help carry medicines. And we noticed that more often than not, things would take a while to get from point A to point B. Samples would get lost, medicine would get lost, and ultimately the medical supply chain was not very responsive to the needs of the communities. So I'll take a pause really quick and we can just look at this Wordle we have here, and I'll just briefly talk about this. So one of the biggest things I'm seeing is surveillance, and that's true, especially in the context now. You have military context, you have drones, there is the military aspect of doing reconnaissance, things like that. But nowadays, I don't know if you're too familiar, but you'll see that drones are being used in a pandemic response to actually do surveillance in parks and areas to see, in the US even, they're doing this, who is breaking quarantine. With the current COVID-19 outbreak, you're seeing people are more often than not told, please stay at home, avoid gatherings of more than 5 to 10 people. And what a lot of innovative areas are coming out is people are utilizing drones to survey an area very quickly, a large park. Some of them have loudspeakers and they'll, try to break up the area, send individuals back to quarantine. In addition to that, drones are used for mapping, for looking at groundwork, looking for water speculation, things like that. And I think what we do want to show here is the media and a lot of background on drones. People think of this surveillance piece. People think of maybe a military background. And what we'd like to do is kind of shift the narrative a bit to show that drones aren't only meant for surveillance. They aren't only meant for these kind of reconnaissance missions. They can do deliveries. They can become an integral part of a supply chain. And more importantly, they can be used for health, for benefiting a local population, and ultimately improving the livelihoods. And that's what we're going to discuss in the next few slides. Let me go back to the slideshow really quickly. Okay. All right. So again, talking a little bit about our project background. So we identified Malawi in 2018 as the country we wanted to test. So not only did Malawi have a need for this, as you can see on the screen, Lake Malawi is a very long lake that spans most of the country. And on the right-hand side, you will see the two small islands along the coast of Mozambique. So as we were saying, in 2018, it was identified there was a need case. And also in Malawi, we had a very supportive government who was very open to using this emerging technology. They had a Department of Civil Aviation that was very progressive in bringing drones to the country. There was a drone testing corridor. And what this meant is the government of Malawi, along with civil aviation, designated an airspace in the center of the country for different users to come in and test humanitarian drones, whether it's for medicine or other humanitarian responses. So this was at the time unheard of in the region for a country to be so supportive of a, frankly, an unknown technology to many people. And by having government support, by having support of the local aviation authority, we were able to move a lot more quickly than in other cases. So in April of 2019, we had a stakeholder meeting and a kickoff meeting with the government, with local community members, and with our counterparts. And in June of that same year, we had all of our safety inspections. We tested our flight within that corridor for the government and for civil aviation and received our approvals. 1 month later, in July of 2019, we had our first flights. And so the purpose of our activities, as you'll know, was all along the lake, there's these hamlets. And we really wanted to focus on tuberculosis and HIV samples. And what this means is individuals in these communities get tested for HIV and tuberculosis. They get tested by a local community health worker, sometimes a nurse, very rarely a doctor. And these tests have to go somewhere to actually be analyzed. They can't be analyzed in these very small clinics. So they're sent previously by boat to a larger facility for testing. And generally results are returned anywhere from 4 to 8 weeks later. And you can imagine in 2 months, you get tested for HIV, and in 2 months, you might get your results back. That's a very long time to wait for results. A lot of things can happen in 2 months. And we were finding out additionally that some of these samples were being lost in transit. So if things were loaded onto a ferry, we found often that about 40% of these samples were lost. So what we wanted to do with our project was utilize drones to not only quickly deliver samples from these local communities to the testing facilities, but also deliver the results back to them in the same way. So we utilized a bidirectional model, which means our drones took off from a location going to these communities. They landed in the communities and they received the samples for testing. Then they took off, brought the samples back to the larger testing facility. And not only did they do that, but they would deliver the results back to the patients very quickly. So we were going from a turnaround time of 4 to 8 weeks to a turnaround time of as quickly as these results can be analyzed. And this was an 8-month activity. So it began in July and it wrapped up at the very last day of February. And as you can see, again, as I was discussing, it was the first bidirectional cargo flight in the region. So we weren't just dropping medicines. We weren't just dropping things. We were integrating into the supply chain in Malawi, we were working with the community and we were flying both ways, which really helped kind of, in the context of things, it helps build a more sustainable platform. Another important aspect of what we did in Malawi is this is a very new technology across the world. It's especially a very new technology in Malawi. So we worked with 5 local individuals on the ground. They were former interns or very young, eager individuals, and we trained them on ground operations. We trained them on remote piloting operations. We trained them on how to properly assess a location to utilize drones. And the point of this is we wanted to not only conduct this activity and deliver results, we also wanted to ensure sustainability of future drone projects by helping build a strong cohort in Malawi. So with this capacity building model, we trained these individuals and they've continued to flourish in Malawi. I'm happy to say that some of them have gone on to graduate from the African Drone Academy, which is a first of its kind institution in the region that brings individuals from across Africa and provides training on becoming remote pilots and provides certification on that. And some of our individuals were able to graduate from that class, which is interesting. A few other milestones that this activity completed that, again, we'll go over in a little bit, as we had the first successful night flights in Malawi in which we were able to take off and land at night, which is proving essentially that our drones can operate anytime, any place. And I'll go into a little bit of this in the next slide just to give you an example of just how responsive our drones can be. So just quickly, you'll see on your screen here, we utilized a WhatsApp group for communication. You know, we were discussing ways to best figure out how to quickly get medicines to places, how to involve community members. We looked at different communication platforms, email protocols, and what we found is 95% of the individuals we were working with in Malawi use WhatsApp all day. They use it for calling, they use it for messaging, they use it as social media. It's very common there. So we said, you know, why change anything? Why introduce something new? Let's utilize what's being used on the ground there and let's integrate into it. So we created WhatsApp groups based on individuals making requests. And what you'll see on the screen here is I remember when this happened, this was this early Sunday morning. We received the above message from one of the hospital workers in Usisia, Malawi, which is, again, one of those small hamlets along the coast. And you can see here, he was requesting a rabies vaccine because his child was bitten by a dog. And we saw this message in the early morning and responded 20 minutes later. We worked with our individual on the right here. His name is Sam, who was on the ground. He had to go to the hospital that day, talk with the in charge at the hospital that was on call that day, get approval for this vaccine. And ultimately, by an hour, less than an hour later, we were creating this flight plan. So in the next, sorry, one more thing. What you'll see is 7:49, it took off. We had the flight plan ready, and by 11 a.m. it was received and we confirmed receipt. And what I just want to prove with this slide is our activity in Malawi was focused on sample delivery for HIV and tuberculosis, but drones are very flexible. Our project is very flexible. We can respond to different settings and different humanitarian contexts. And I think, again, the point being, we want people to realize that drones are more than just, like, one of the big words was surveillance. Drones are more than mapping. Drones can be integrated. Drones can be humanitarian in nature, and drones can ultimately help improve lives, as you'll see here. Just to go into a little bit more about some of the, I guess, technological and operationalization of this. We have here on the right, quantity of lab samples sent. And in red, this is what was sent in 2019, months we were operating our drone. And in gray, this was in 2018, before our drone was utilized. And you'll see here, every month our drone was operating has up to 6-fold times the amount of samples being sent. And what we're showing here is our drone enabled more testing to be done, more results to be delivered, and ultimately more people finding out if they are HIV positive or TB positive, which means more people getting on regimens for treatment. So the longer we were working, the more we realized our drone was being used. So we would often talk with these hospital staff, and it was a process which we'll talk about a little later of getting the hospitals on board to use the drones. You know, it's a new technology. It's something that's unknown to them. They see a big machine flying and it's loud and they're not sure what it is. It's unproven. And it took a bit of prodding at first, but the more these individuals utilize the drone, the more they realize, wow, this makes my job easier. This gets people results faster. And it's ultimately streamlines everything. So what our system did is we didn't want to create a parallel supply chain here. We didn't want to say, oh, you were using this method before, we're going to change things. We're going to introduce a drone and you're going to have to learn this new technology. We didn't want to do that. We wanted to integrate with the current supply chain and provide improvements where possible. So we utilized the same points of contact at the hospital that were previously doing this testing. The only difference is we looked at them and said, hey, how about instead of sending your samples on a ferry, we'll teach you about our drone. We'll help train you on this. And ultimately, if you utilize this drone for this activity, we think you'll see better results. The longer we flew, the more our drone was utilized. And just some numbers, if you're curious, is during this 8-month project, we had over 400 flights and flew nearly 20,000 kilometers. So we had a lot of use, and each month more and more use happened. So again, the longer we operated, the more test results we had, the more people learned of their test results, and more people were being put on health regimens. So go on to the next slide. So unfortunately, our staff member who worked on Chizumulu Island, one of the islands in the lake, Ford, who was on the right in the picture, is unable to join, but he did provide a video, and I will just quickly show you a brief snippet of some things he wanted to say. The audio should be able to come through, but do let me know if it does not work.
As I said, like in the past, we used to have a long time retaining rate for the results. So we are going back to the very same old ways which we used to do. Whenever we take the samples, they stay maybe 3 months, 4 weeks without having the results. You know, we are relying on Ilala. So Ilala maybe gave somebody the results, maybe you press them somewhere whereby you forgot to give to the lab personnel. But with the drones, it was really helpful just because the very same day they were taken to the lab. But in the old days, it was really not happy. It was not working. It was not working.
And with okay, so again, you'll see Ford is talking about how prior to the drone being used, things were taking forever. Samples were a mess. Things were getting lost. Things were taking weeks and weeks. And the issue is if a lot of times we found out and talking to the community, if you're a patient in this small community, you may hear, oh, the local clinic is able to test you for HIV or tuberculosis. You may go to that clinic and perform a test. Next thing you know, you don't hear back from the clinic. You are curious as, I thought I took a test. How come I don't know? Maybe 8 weeks later, you get a result, or maybe your test was lost and you have to get retested. That's not going to build a lot of trust and faith in your health system, and not a lot of patients are going to come back after that experience. So by improving the time of results to deliver these results to the patients, we also improved adherence to regimens, and we improved the ability of these patients to know the results and ultimately become healthier if put on a proper regimen.
That's said.
Let me just go to the next slide. And a bit of some of the successes and challenges I will just be covering for Ford. As we mentioned in Chizumulu, there was the issue of testing and treatment. The longer results took, the less adherence to the regimens, the less people that would even come for testing. At the time we entered Chizumulu, they were only doing testing every Friday. They were doing mass testing every Friday, simply because the demand was lower and they had to adhere to the ferry schedules, which happened to be every Friday. By the end of this activity, they were able to test for HIV every day. So if you're an individual in Chizumulu, say you're a fisherman, because the majority of the economy there is based on fishing, you're out on a boat 6 days a week. Maybe you take Wednesday off. You want to get tested for HIV, but the clinic isn't testing. They're only testing on Friday. Ultimately, you're not able to be tested. However, after our drone implementation, people were able to be tested every day. So now you may be a fisherman and you have a Wednesday off. Now you can go to the hospital, be tested, and get your results dispatched back to you much quicker than prior. And again, we learned that for this to be a successful activity, we really needed the community to buy into this. So this was a big initiative on our part. We held community meetings. We had radio messages discussing our drone. It's an unknown technology. Frankly, to some people, it's scary. You hear a big whirling sound and you see a flying bird coming in. This is the first time some people in these communities had seen anything resembling an aircraft. So we had to work with local community leaders to ensure that the community was aware of this, but more importantly, any questions they had, we answered. And on Chizumulu, we found that after a few weeks, the community was very supportive of this. You know, there would be days where the weather was bad and, you know, maybe there was storms and we weren't able to fly, and we would receive WhatsApp messages like, is the drone coming today? You know, we really miss it. They were very supportive. They would always keep track of things. You know, if even if there was a storm, we would have people on the island telling us, oh, it's the storm is coming here in 20 minutes, so hold off. Or, you know, the community really bought into this. They started even proposing ideas of their own of, you know, in the future, how drone interventions could help with perhaps child delivery services, things like that. So a key takeaway of this is just that it's always important in these initiatives to get that community buy-in, because it's necessary to operate, but B, by doing so, you begin building a relationship, you begin sharing ideas, and you get that innate support that can help your project flourish. So again, we had great success with that on Chizumulu. And I have one more short video we'll cover. Again, hopefully this audio works.
And for your community, how have you seen the drones impacting Chizumulu Island and the Malawi community?
Yeah, at first the community was like, what is this new thing coming in? By and by they realized that this thing is very important.
Yeah.
For example, we had the samples which we got from a suspect of TB. We got the samples, sent them to Likoma, and they were tested through the gene expert. The very same day we got the results through the phone, of which the very same day we started the patient the regime to start the drug for TB. Then the next day is when we got the official results on the paper. When the community realized that this is what has happened, they took not for granted, but they said this is a very important thing, since it helped the community in terms of case the identification. For example, you detected the case very quickly rather than what was being done before.
And when you can deliver the results more quickly to the patient, how does that impact the patient? Does it help them as well?
Yeah, the patient were being helped just because it was like they were relieved to them once they are known that they're having this illness. At the same time, they were being switched to the treatment. So before they were taking too long, but now in 2 days, day, the patient is switched to the treatment. So it was very helpful to the community, to the patient.
Great.
Okay, so again, you'll see there that just discussing by using the drones, patients are able to get their results quicker. More people are able to be treated. There's just more success. You can also jump on top of outbreak. If there's an HIV outbreak in a community, and you're able to more quickly get test results, you're able to respond to it quicker. And again, if I'm hoping to send out a video, another recorded video from Ford, but the community really bought into this, and they love this activity, and they're very supportive of drones, a technology that was previously unknown to 95% of these individuals. Okay, let me just go to the next slide. Okay, so now I'm going to send it off to Lewis, who works for Swoop Aero, and Lewis is going to talk a bit about more specifics of the drones, of utilizing vendor services, and just of his experience on the ground in Malawi. So Lewis, go ahead and take it away.
Yeah, perfect. Thanks, Ryan. So as a quick introduction, my name's Lewis. I'm the Director of Flight Operations at Swoop Aero. Swoop Aero is an aeromedical logistics company, and we have a vision to provide accessible healthcare to everyone, everywhere. And part of this project in Malawi was instrumental to achieving that. My role at Swoop Aero has me supervising flying operations internationally. It has me as the Chief Remote Pilot. And my background's a little bit different. It's from manned aviation with the Australian Air Force as a Hercules pilot, flying instructor, and operational test and evaluation pilot. And we rely very heavily on applying that manned aviation experience within our team so that we can roll out drone networks, including this one alongside Chemonics and USAID, reliably, safely, and sustainably. So a little bit of other background for what we've been doing recently. We've also been involved in operations in both Vanuatu and DR Congo. And I've also recently returned from Mozambique, doing flying demonstrations there just prior to the COVID-19 outbreak, where I unfortunately had to come home. But we'll go into a little bit more detail just on what we've got in terms of a company and our technology. If we go to the next slide there, please, Ryan. So we are an Australian-based company, but operate globally. And as I previously indicated, we give access to the air to move essential products on demand to places that would otherwise be impossible to reach. We deploy, as it says there, sustainable, safe and reliable aeromedical logistics networks to places that would otherwise be isolated, difficult to reach, or that would otherwise have a high cost to service. And as Ryan's already highlighted, one of the unique aspects of the service and the technology that we have is we can facilitate an on-demand two-way service. So not only are we able to distribute medical supplies to a location, but because we're landing in that location, we can pick up the samples in that location at the same time and bring them back to a central processing facility. So it says there in the last bullet point that we cover large distances at high speed. So what does that physically mean? Well, presently we can transport up to 3 kilograms, 135 kilometers in just over an hour. Our aircraft don't require any expensive infrastructure. They can be piloted from anywhere in the world with something as simple as an iPad or tablet PC. And this is facilitated through utilization of existing 3G, 4G network infrastructure, as well as our own satellite link that we set up at the same time. And as part of this service, interestingly, we managed to have our team arrive in Malawi, and 48 hours we were conducting flights in Kasungu, and that was without any need to pre-ship any equipment. So the network and the aircraft can be very quickly set up and then facilitated. We go to the next slide there, please, Ryan. So, as I said, we've got cutting edge technology supporting the local community, and we really do focus very heavily on onboarding the local community, such that they're responsible for not only operating the service, but they have ownership over the service at the same time. In terms of how we do this, the overall aircraft is designed to be highly autonomous, easy to operate, such that it facilitates rapid onboarding and upskilling of local staff. So you've already been introduced to Sam there by Ryan, but he comes from Carter Bay. He's a local football player and business operator, but he's also our hub operator for the Carter Bay project. And since he was our hub operator for the Carter Bay project, Sam has travelled down with us to southern Malawi and is helping to not only facilitate the service in both the Chikwawa and the Sanjay districts there, but has also progressed into the role of a trainer, where he's training up additional locals to also perform that hub operator role beside him in additional districts where he can't be at the same time. Ryan has focused pretty, if I go to, sorry, Ryan, just back one slide. Thanks, mate. Yeah, Ryan's focused pretty heavily on community engagement. And the reason for that is because it's an incredibly important thing to gain acceptance of the service that the community is heavily involved. So the way we achieve that is we have local health staff and trusted community members trained to clear the takeoff and landing site, also to load and retrieve the cargo, and remotely signal to the pilot that they're ready for the aircraft to take off. As Ryan's already highlighted, local communities immediately see the benefits of the service, and we've received a breadth of really positive experience, as you saw Ford provide there in a previous video. And the last bullet point there is safety always. So when Swoop Aero was first founded, we found that there were a number of operators that were attempting to utilize hobbyist style drone products to achieve a commercial outcome. And based on our experience operating C-130s and other aircraft in the military, we asked ourselves the question, could we apply the same operational principles and safety requirements that are required of a 175,000 pound aircraft to a 15 kilogram drone? We found the answer to that was yes. And thus our focus to this point at Swoop Aero has been to apply this mentality throughout our entire product life cycle, from aircraft design to procedure development, testing and subsequent deployment. And we believe it's this focus on safety that also helps to facilitate the community confidence in our product in combination with all those measures that, that Ryan spoke about before. On the next slide, so we've got a few of the challenges that we had to overcome when operating in Malawi. With the vast distances we're covering over sparsely populated areas, it probably comes as no surprise that a lot of those areas have quite poor communications infrastructure. So when you're trying to deploy a new product that's foreign and not really known to the local communities there, and you don't have open lines of communication over those long distances, it becomes very difficult or a challenge in order to ensure that they're ready for the drones when they arrive, and that the drones contain what they need when they arrive at the same time. So what we found is by adhering to regular transport schedules, and we could also utilize the drones as a carrier pigeon to carry notes, we were able to overcome some of those challenges. You also saw Ryan highlight some of the rigid communication channels that we put in place, particularly via WhatsApp, to ensure that there was no confusion surrounding the specifics of the operation. You'll see in that slide to the right-hand side, and I understand we're running out of time here, so we'll keep this short, but you can see that we've got Lycoma aerodrome there, and the black lines to the north there indicate the path that the drones took to come into landing. And what you can see there is it's in close proximity to the approach and departure paths for the runway there. So it was very important to us that we closely engaged the local operators that operated to and from that aerodrome, the main one with Ulendo, and made them aware of what we were doing, the times we were operating, and that we were also aware of the times that they were operating, so we could positively deconflict. We did look at moving the takeoff and landing site, but then it would mean the local health staff had to travel further in order to utilize the service, which meant we pulled them away from their core duties for extended periods of time. So yeah, it was just an important point to highlight, I guess, stakeholder engagement is really important to kind of focus on at an early stage to ensure that everything is as safe as possible. The last 2 points there are probably unsurprising, but in Africa, you've got unreliable power and harsh environmental conditions to overcome, requiring lots of battery backup sources and lots of reliability and backups within the systems themselves in order to ensure that they can continue to operate in that environment.
All right, thank you very much, Lewis. I believe Ashley or Adele might have posted a poll in here. Yes, so if you look on the bottom of your screen, there should be a poll. If you want to go ahead and submit your answers, I will look into those. Okay, so I'm just looking over, and it looks like the majority of responses have indicated that government regulations are some of the biggest hurdles to utilizing drones in your country. And again, we have, this is our experience as well, you know, getting not only the government on board, but getting local, smaller governing bodies on board it can be an issue. Before we consider a country, we do have to look at the drone regulations. You know, there are some countries in the world that flat out say you cannot utilize drones for anything. The government or military may be in full control of any drone operations, and it's strictly forbidden. In Malawi, we found a very welcoming government, very welcoming civil aviation authority. And not only were they welcoming, they had worked to actually create a very defined set of regulations of what you can and can't do with these drones. And what that helps us do is it gives us context, and it gives us a norm of what we can and can't operate in. And the more that's defined, the better. And I will say, it seems that in the past even few months, more and more countries are starting to kind of codify their drone regulations. I believe Kenya has just come out with a new set of regulations. It's becoming more and more codified into law. Even in the United States, they have drone operator licenses now to operate certain drones over, I believe, 7 to 10 kilograms, things like that. So you'll see that the government regulations is a very difficult hurdle. Ways to overcome that, you know, it's advocacy. It's finding the right individual to connect to in the government that can help advocate for your project. And one thing that we're hoping our activity shows is, I think a big hurdle governments have in approving these drones is they see them as they could be dangerous. They could be used for acts that threaten them, whether it's, you know, some people believe they could be used for surveillance of things they don't want seen, things like that. What this activity shows is drones can provide a public health benefit. They can increase your government's response to health outcomes, and they can ultimately help create and bridge that gap between government and constituent, or doctor and patient. So we're hoping, as projects like ours continue, that those government regulations become more codified, but become more open to these types of activities. Another issue that was spoken about is financing. And again, yes, I mean, drones, I don't think we'd ever say that if you have to take something from point A to point B and it's 1 mile away, you know, riding a bicycle will be cheaper than utilizing a drone. But again, one important thing to realize in the context of funding or fundraising is the outcome is important, just as, and it's important to look at the situation. So yes, if something's going point A to point B over a mile, you can take a bicycle, you can take a car. What if a bicycle or a car isn't possible? You know, in terms of health, if the options are delivering medicine to a person with a drone, or not delivering any medicine at all, I think those are the types of questions and things that need to be brought to the forefront of any sort of funding discussion at a high level. And another important thing is, this is an emerging technology. The drones they haven't been around for, you know, 50 to 100 years. I like to think of an analogy of televisions in terms of drone technology. You know, 20 years ago, everyone had a big boxy cube TV that took up a bunch of space and cost hundreds of dollars if you could even get one of them. Nowadays, TVs are smaller, they're better, and they're extremely cheap compared to the price when they first came out. And I like to think of like technology such as drone technology as similar. You know, the longer it operates, the more cost savings projects can identify, but also the technology itself becomes bigger, better, and ultimately more cost effective in the long run. Some other things, local capacity and human resources. Again, yes, the majority of countries that we would look to operate in are frankly don't have experience working with drones. I mean, no country had experience working with drones 20 years ago. So it's important for projects like ourselves, and if you are considering an activity to use drones, that's why that local capacity building is important. Because what we do want to make sure is after this activity ends, you want to leave a legacy. You want to start building that cohort of individuals. So eventually, the area where you're doing work, you might have very young, eager people that might say, you know what, I have an idea to build my own drone using local resources, and situations like that arise. And that's why, again, capacity building, I think, needs to be important in any sort of project, especially one as innovative as drones. So I'll just
Yeah, and I'm
continue.
going to interrupt
And,
there. I
mhm.
think that might be a good place for me to ask one of the questions.
Oh, Ashley, can you increase your volume on your microphone?
Yes, is this any better?
Yes.
Okay, so this is a good place for me to interrupt and ask one of the questions that's been raised. And I'll ask both you, Ryan, and Lewis for your thoughts, but someone threw out a question. When will this amazing drone activity be scaled to other regions like East Africa? In Uganda, for example, HIV patients are finding difficulties getting drugs, specifically during the pandemic. So you have spoken about, I think, some of the major hurdles being funding the regulatory environment, enabling environment in countries. And I'm wondering if either of you would like to speak to the challenges in working to scale the activity, which is part of the question there, and just scaling an operation beyond a small region of a country like this particular activity, and then what it might look like to scale to multiple countries and what the challenges there are going to be.
Yeah, I mean, I'll give my perspective. I think Lewis will have a lot more of a breadth of knowledge in this, but from my perspective, I think the challenge in scaling regionally is every country, every locality has a different drone regulation. And until there's an overarching body that oversees this, it's always going to be kind of a push and pull with these governing bodies. So if we're operating in Malawi and the country next door, Mozambique, wants to utilize drones, that's an entire different government we need to get approvals from. That's an entire different setup of whether it's hierarchical or whatever that structure may look to be. So expanding and scaling up regionally, it's like a lot of regional bodies in that it needs buy-in from every country. It needs some sort of coordinating mechanism. And again, I think recently there's been steps to make that more of a possibility. But I would say that's one hurdle is again just the regulatory framework, getting countries on the same page. Because if you go from country A to country B, the regulations could completely change. You know, they may say drones can only fly 400 meters. Some countries may say drones have to fly between 300 and 600. You know, they small little nuances like that can really they can really detract from being able to streamline things. You know, if the regulations are so stark and so contrast, it's almost like it requires a separate response. That said, again, I think as this technology continues to expand and things like pandemic responses, I do think the stark reality that people are facing now is this is a huge issue, and now is a good time for these governments to reassess regulations and maybe become more progressive like we saw in Malawi. And maybe because drones can provide that step of whether it's helping remove nurses and doctors from physically needing to transport things. But in the sake of time, let me let Lewis chime in on this one as well.
Yeah, no, thanks, Ryan. I mean, you pretty well hit the nail on the head there in terms of regulation being one of the challenges to overcome. But I think it's important not to see regulation as a blocker. So regulation is there to keep everyone safe. And as Ryan highlighted, every country approaches that in a different way, which is where the challenge comes in. Just because you have a approval for one nation does not necessarily mean that that transfers directly over to another nation. There is an international construct in place for the assessment of risk associated with drone operations. It's called the JARIS SORA, the Specific Operational Risk Assessment. However, again, every nation approaches that and requires different information to kind of back up a company's claim about the safety of their platform. To add in additional complexity, every location that you operate in with a drone is going to be considered slightly differently. So if you're operating right next to an international airport with a lot of movements going in and out every day, that's a very different case to operating in a very isolated regional area where you could kind of consider the risk of a low-flying aircraft being there to be extremely low. Similarly, if you're going to be operating over the top of a capital city, that risk case is going to be considered a lot more differently to over a sparsely populated area. So yeah, I mean, we'd love to see this service rolled out to as many different locations as possible. And it's just part of working closely with those regulators to achieve that, but at the same time, achieving funding and making sure that it's done in a sustainable way as well.
Thanks for that question. It's a great question, and kind of brings us just a quick wrap up slide in the sake of time. But again, just these are thoughts you should consider, and in any context. And we've kind of gone over all of these is balancing training and operations, and kind of what you want to realize when doing this is, again, drones is an investment. The longer you have these operations running, the more cost effective it is. And drones do things that other delivery systems can't necessarily do. You know, a truck can't go into a mountainous region on the coast. And again, like, think of community involvement's important, and engagement. And also, if you're looking to get that government support, it starts at the grassroots. It starts with that community buy-in. So if a community is very supportive of an initiative, the more and more support you get at that ground level, the higher up it goes, and eventually, that can help overcome some of these hurdles that we've been talking about. We know we're running short on time, so I will go to kind of this last slide, and just talk about what's next. So, drones aren't just for health, as we've discussed. They've been used for surveillance, but they've also been used for other things like planting seeds, spraying for malaria. They've been used for surveillance of temperature in pandemic responses. They've been used for disinfection spraying. And these individuals on the right in this picture, I believe this is in Spain, they've utilized drones to disinfect certain areas of the streets. And again, as this drone technology continues to emerge, more and more technology is being created, more and more sustainable activities being created, costs will come down over time. And even in Malawi, we've evolved from this. And I will let Lewis talk about that briefly as well, because he has some experience on just beyond what we've been doing in Nkata Bay.
Yeah, sure. So post Nkata Bay, we've had an opportunity to continue to operate our service down in the southern region of Malawi, specifically the Chikwawa and the Sanje regions. And we had an interesting case pop up where we'd started rolling out the network there, started doing a lot of the community engagement and liaison and training up the local population. And then COVID-19 hit.